to look in particular at how to strengthen the community level in health response of various kinds. My name is Matthias Schmale. I'm the moderator and chair of this session.
Fragile states are very different and have different reasons they're fragile. And the more we get into where we are in development, I think the more refined we have to be and the more country-specific we have to be. What does a country need that might be a fragile state, not what do fragile states need?
One of the actions that has been taken in the sector, which we are very proud of, is defining what we are going to provide to the population. What do we mean by healthcare? And the focus was on rural population, the focus was on maternal and child health. And so we defined these elements of healthcare and we called it basic package of health services. This has happened in 2002 and 2003. And then we went into a large-scale nationwide delivery of basic package of health services.
If I may turn to, in a sense, civil society, Dr. Ahmed, your Red Crescent is often credited to be one of the few, if not only local organizations that has provided basic healthcare through decades of extensive and extraordinary challenges. Can you share with us, like the Minister, some of your lessons learned from a local organization perspective for successful health delivery?
You know, some time ago, Al-Shabaab banned the polio vaccination. SRCS has been mandated by WHO to talk to Al-Shabaab. They were saying that all the days are the same in Islam. And the NID, the National Immunization Days, cannot be accepted. Then they said also, when they make campaigns, they bring together female and men. And this is cannot accepted by Al-Shabaab. So all these arguments we said. At certain point, we negotiate with them, and the polio vaccination has been accepted in general. But they said that they should be conducted by local SRCS and local NGOs in the facilities, not campaign.
In the early 90s, we started supporting the creation of a local organization called CNA, Khmer HIV/AIDS Alliance, which has today become the largest NGO, full stop, in health, in HIV, and anything in Cambodia. Even in a country that is sort of on the verge of starting to revert into a sort of more fragile situation, there's a strong civil society, I would argue, now that has been built, and I am one that is convinced that nation building is not just about state building. It's about building engaged, inclusive societies with strong state, but also with an active civil society that will contribute to that. And in that sense, for me, Cambodia has been an example of what is possible.
Often in fragile situations, external partners are engaging heavily and try to come up with governance arrangements that may not fit very well with local circumstances. I read a little bit up on the Somaliland experience, and I understand one of the secrets of success is that they didn't have that much access to the international development assistance. They really had to come up with locally developed institutions and arrangements that reflected local priorities and cultural aspects. So I think finding this balance would be important.
Yes, we need the countries to engage and to fund part of the response, but we also will need an international solidarity that is not based on charity or just on a development assistance model.
I think the question of how much this links to areas outside health sector is very valid, and when it comes to health outcomes, it's not only health sector that produce those outcomes. It's very much related to education, to road, to infrastructure, to electricity, to water and sanitation, to food security, nutrition, employment, women's status in the society.
You have to have a functioning government to move from fragility. But at the beginning, you often don't. And that's where you take a mixed approach and a more nuanced approach based on that country's circumstances. You have to actually have goals and targets underneath that for specific health outcomes, or you actually don't get healthy people. So we need the intellectual conversation, but I think then we need to get down to how do we actually support countries.
HIV/AIDS produced from the UN General Assembly in 2001 really a framework of reporting and accountability with clear targets that are not about reaching 80%, because we know who the 20% that gets left out is, but targets that have equity sort of as a fundamental issue in them. That's what HIV/AIDS also proved to us, that if you concentrated just on reaching those that are easy to reach, it looks quite good on your report. It doesn't actually contain an epidemic. So unless we build equity into the targets, we will achieve our targets but miss our goal.
The issue of safer access is very crucial, and we are working on that with the IFRC, especially safer access for volunteers, for health workers, and so I think we hope that we could accomplish better this safer access.
We work primarily with governments, but we can convince and work with governments to convince them to engage directly with vulnerable communities. And then the challenge will be, once the project ends, whether they will actually continue and take it over and continue to fund these projects.
Two final thoughts from my side. I think there's a lot of fruitful collaboration that can come between newer players and old players, also in the sense of innovation and learning. And then I was struck by Mark's comments and response in terms of let's not theorize. So I think what shone through all the interventions is, in order to make this peaceful contribution, at the end of the day, it's about being pragmatic, understanding the context and being a pragmatic solution focused.
My final reflection would be, we need, as all of us, at the global level, at the national level, government, international community, civil society, really work. I think we can do a lot, all of us in our own capacity, to bring harmony, understanding and peace to this world.